every year, 10th of October is observed as the World Mental Health Day all over the world. An aspect of the mental health care is taken as the theme for this particular day, and various programs and projects are initiated on this day and run through 1 year to enhance the mental health care. This year, the theme of the World Mental Health Day is Mental Health for All, Greater Investment, Greater Access. This is a very important aspect of mental health care. WHO has observed long back that in all countries, at least 1% of the population has serious mental disorder which needs active psychiatric treatment, and at least 10% of the population will have such a problem at least once during their lifetime. Another observation that has come is 5 to 6 times this number, that is up to 5 or 6% of the population has major mental ailments, not necessarily mental diseases, but major mental ailments which cause a lot of suffering. Obviously, this, when it is presented in terms of the percentage, may not appear very substantial, but translated into absolute numbers, this gives an idea about the huge burden of mental diseases or mental disturbances which are there in the population and which has to be managed by the healthcare sector in all the countries. But even in advanced countries, there are not enough resources for establishing mental health care facilities to this extent. So we have to enhance the facilities, and obviously it needs more investment. But if you just look at it, the present concepts and considerations of development in medicine is more on the side of bringing more and more technology. And in the field of mental health care, more than technology, what is necessary is more specialists, more of working space, more of facilities for people to work, and that is what is required. Now, another aspect is the getting more of investment is not an easy task. There are competing interests. So it's equally important that existing facilities are to have a better access, sufficient access to patients and their families. And from this perspective, it's very important that we find innovations or technologies to enhance the access. One important problem with treatment of mental disorders is the stigma attached to it. Secondly, the problem, the patients most of them cannot come alone, they have to be accompanied, and all this, and many of them drift down the socio-economic scale on account of the disease. So affordability to transport, all these things are there. As you know, COVID-19 pandemic has changed the face of healthcare all over the world. Healthcare is totally disrupted, and access to healthcare has become a problem in all branches of medicine. And it is in this context that telemedicine has been introduced as an alternative wherever possible, wherever it is feasible, where quality medical care can be extended through telemedicine, it has to be set up. And when you just look at it, mental disorders, they are more suitable for telemedicine mediated management. The diagnosis, the treatment planning and even delivery of treatment services through telemedicine can be very effective in the case of many a psychiatric disorder. And so telemedicine mental health services, in short, tele-mental health services certainly would add to the access to mental health care in all institutions, all healthcare settings. It would be appropriate for the healthcare institutions and healthcare facilities to enhance their telemedicine platform or tele-mental health platform, and for patients and their families to make use of this facility, to harness this facility so that access to healthcare is enhanced. And this goes very well with the theme of this year's Mental Health Day, and I